In the pharmacy, we see a lot of asthma patients who cannot demonstrate properly on how to use their inhaler. This inhaler is called a meter dose inhaler, and it is composed of these parts. We have the cup, then this one is the mouthpiece. This whole thing here is called the actuator, and this is the medicine which we put inside here. This meter dose inhaler usually contains short-acting bronchodilators, a drug that opens up the airways so that it will be easier for the patient to breathe. Its action will last only for about 4 hours, which are used as rescue medications. This medicine canister contains the drug and a propellant. That is why it is very important for us to shake it before using. If you have just opened this inhaler, the first thing that you should do is to prime it. Priming it will make sure that the mechanism is working properly. You prime it only once, the first time that you use the device, or if you have not used the device for some time, in 2 weeks. So you have to prime it. You hold this like this, okay? Not like this. That is incorrect. So it has to be upright like this. Then you hold it with your thumb at the bottom and then your index finger, maybe together with the middle finger on top. And then you're going to press this, press. If you find it difficult to do this, you can do this. Step number 2, to make sure that we insert it into our mouth properly. Since this is the mouthpiece, we are going to put our lips around the mouthpiece and make sure that we cover the mouthpiece so that there will be no air that can come out. Like this. And make sure that your tongue is not covering the mouthpiece and it is not covering your throat. Make sure that this is upright. Okay. Number 3, let us practice the breathing technique. When you press this, there is going to be, can you see it? There. We want that mist to go through our airway into our lungs. So how do we do it? That can be achieved only if we inhale properly. So let's practice. The breathing should not be too fast. If you do it, most of the medicine there will just be deposited at the back of our throat. So only a small amount of the drug reaches the lungs. So we do not get the optimum dose that we need. Okay. But if you breathe also too slowly, like most of the medicine will be deposited in the mouth. And so therefore, again, we don't get the maximum dose that we can get from that actuation. So this is how we breathe. Practice. Slow and long. Slow and long. Like that. Again. And then you hold your breath for about 10 seconds, more or less. So you just have a mental counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if you cannot hold it up to 10 seconds, it's okay, as long as you hold it long enough. So we would want all the drugs to really reach into our lungs. Next, timing. So we are done with our breathing, okay? What is the timing? When will you press this? Okay, you press this when you already started to inhale. Okay, you start inhaling. Air has to be drawn into the lungs already. And then press. Continue. Okay, let's do it. I'll do like this if I press already, huh? But I will not be pressing this because there's a drug inside and I don't need the medicine. Okay, I will just say like that. That means that I'm pressing this already. Okay, let's do it. Since this medicine canister contains the drug and the propellant, we need to mix the two together. Okay, so shake it like this. You exhale first. When you exhale away from the mouthpiece, okay? Don't exhale here. No, it's wrong. Okay. The correct way is, so let's do it from the beginning. This is your meter dose inhaler. You're going to open the cup and then you need to shake it because we want the drug and the propellant to mix together. If you miss shaking it, then you may be getting more of the propellant rather than the drug. And then you close it again. Let's do it again. This is your rescuer medication or reliever medication. That means that you need this if you are feeling tightness of the chest or having difficulty breathing. Therefore, you always bring this with you anywhere you go. Put this in your bag or in your pocket. Then once in a while, you have to clean this. You can just take this out and take this out, and you can wash this with water. Let it dry, and then once it is dry, you can put all this again. And then before you use it, you prime it again. This medicine that I am using right now does not contain any corticosteroid, so you don't need to gargle or wash your mouth after each dose. But if, in case your meter dose inhaler contains a corticosteroid, you should not forget to wash your mouth or gargle or swish after each use. You can ask your pharmacist whether your inhaler contains any corticosteroid. If you have any question about your meter dose inhaler, don't hesitate to ask your doctor or your pharmacist. So now you know how to use your meter dose inhaler already. Share your knowledge to your relatives and friends who also use this type of inhaler. Or you can tell them to watch this video. There are other types of inhalers. Be sure to watch our video on the proper use of this type of inhaler. Please subscribe, write your comments, ask questions, because we will have other videos coming up.